the criteria. Elderly patient who cannot understand the problems with these devices, or who cannot call for help when they need the devices, when there is anything wrong with the devices. Patient whose expectation is high, like they don't understand that they have a chronic pain, and the chronic pain is going to stay for years and maybe for life. And this is not a cure. This is a way of helping them to live their life and control their pain and go back to their work. And some patient we see a complete cure, and some patient even, complete relief of pain, not a cure. And we see some patient even they stop taking other medication by orally or tablets. Some patient go back to work. And this is what we want them to understand. The second thing is patients who are, your fear of patients is patients who are already a drug seeker, who shows a drug seeking behavior, patients who are dependent on the medication. These patients are not a good candidate. We worry from misuse of these medications.
What about patients who have respiratory problems like chronic obstructive airway disease or asthma? Is there any contraindication in case there's leakage of the drug? Or
there's no absolute contraindication for these medications like anything else in medicine. But, I mean, these patients, we need to be careful with them. We need to choose a drug which is less respiratory depressant or less complicated from respiratory point of view. We need to be cautious. And we need to inform the patient about these problems. But there is no absolute contraindication for such medications.
And patients with ischemic heart disease or hypertension as well, is there any?
No, there is no contraindication as long as their blood pressure is well controlled and their other problem is well controlled. Other patients that we worry about, patients with psychological disturbing behavior.
Yes.
These patients will not understand the aim of these devices, will always have pain, and they want other methods of treating these patients. So we need to be careful with these patients. We need to expose all these patients to psychological assessment. And this is the thing when I said we need a team of pain team, not only pain specialist. And we cannot insert any spinal cord stimulator without consulting clinical psychologist and other support.
So it's a whole team member work with a lot of specialties cooperating with each other to assess the patients fully, the condition, whether they are applicable to use such device or not. So this is something very reassuring. Is there any cooperation, Dr. Asmhan, with the other centers in Kuwait? And I want to talk especially about the cancer center here in Kuwait, the Mekki Jum'a Cancer Center, for alleviating the pain or chronic pain which happen in the end-stage type of patient with end-stage cancer. Is there any cooperation with them?
We do see sporadic cases referred to us from KCC or other hospitals with patients with chronic pain. But as I said, we are just starting. This is a new specialty in Kuwait. It's not even 2 years old, this specialty, I mean, as a pain specialist and pain clinics. We see patients with cancer, and we do offer them certain procedures or patient medication management. But as a center, no, we didn't start any work in KCC, but this is our plan in the future. The plan in the future that to go for a pain center, and the pain center should accept patients from all over Kuwait, including cancer center. There is a huge bulk of patients with chronic pain comes from the cancer center. But I think it's a big commitment, and it's a big responsibility, and we need to look into it in the near future once we have all the facilities. And I think the pain center will be a good place to start from.
Okay, now this is something interesting. We've been talking about the adult group, but what about the pediatric group? Is there any place for such devices to manage pain in the pediatric group or children?
Yeah, I mean, you do have a pain specialist for pediatric pain specialist like any other specialities. I'm a specialist and an adult pain specialist. Of course, chronic pain can affect children and adults of all ages. And there is pain specialist for pediatric. Unfortunately, we don't have one in Kuwait, but we are try our best to help whenever needed. These devices or these method of treatment, pharmacological or non-pharmacological, are all applicable for children of certain age. And if not supported, I mean, if it's not managed by the patient themselves, being children, usually it is managed by their parents or the caretaker.
Actually, you've said something very important. We've been talking about the chronic type of pain and how we manage it. But as I said, there is also a place for the managing pain also in the acute type. And when we talk, as you said, patients who are post-operatively or in the prior to going to surgical procedure, you can also help such groups, right?
Yeah, I mean, most of the pain specialists usually are anesthetists and intensivists. And I mean, before we did pain even, we managed patients for post-operatively, and that's where, the field where we started. We do see patients pre-operatively, and we assess them, and we discuss with them the method of pain we are going to offer them post-operatively or even intraoperatively. If we're going to give them local anesthetic, or we're going to give them infiltration, or we're going to give them any blocks or any epidurals or spinals. And we discuss with the patient, and we take their consent, and we see how happy they are with it. And then after a surgery, we talk with them again, and we see how effective it is post-operatively, and we follow the patients. And this is I think we have it in every hospital in Kuwait. We have something called acute pain management.
And this is, do you have noticed yourself and your colleagues in the hospital that there is increase in the awareness of patients and having options in using which type of pain management regarding their procedure? Do you see that is increasing in Kuwait, or it's the same as it used to be?
No, I think over, not even over the last only 2 years. I think it's been happening over the last 10 years or 5 years. People are more happy now to be awake during surgery, are more happy to have local anesthetic instead of general anesthetic, because you can send them home early. They don't have all the side effects of the medication of general anesthetic. They're more educated nowadays, and they go and read about it. And the misconception about local anesthetic and causing paralysis and causing side effects are getting more, people are getting more aware of the advantage of giving local anesthetic or pain relief method pre-operatively. Even if it's given with general anesthesia, they do accept it. I find that once you explain it to the patient nicely and be honest with them and tell them about advantage and disadvantage, I think most of the patient will do the best choice.
This is great. Now, Dr. Asmhan, do you see anything as a new revolution or a new era in the pain management in the coming years or in the near future in this field?
I think we will see more of the advanced technology like radio frequency, neuromodulation applied to a new indications or new patients. And one of the things that I just been recently involved in a research in Edinburgh, where I teach postgraduate students, we are using the neuromodulation for treating patients with headache. And I think we see promising results.
Yes, this is great. Actually, Dr. Asmhan, we are coming, unfortunately, to the end of this program, and it is a very interesting and a very helpful subject to talk about, especially in the field of pain and its management. And at the end, would like to ask you if you have any final word or sentence or advice for our viewers.
I'd like to thank you, Ghada, and Dr. Walid for inviting me to speak today. And it's a great pleasure for me to be here with our people. And I think the message to send people that nowadays there is a chronic pain specialist around in Kuwait, and we do have chronic pain clinics. And if you have chronic pain, don't hesitate to ask for help. And I think there is a new revolution regarding pain, and it is a very growing specialty, and you're all welcome.
Thank you very much, Dr. Asmhan. We've enjoyed this evening and the topic you've came tonight to talk about, and we are looking forward to see you again in the near future with other subjects and other things to discuss more in depth. Thank you very much, Dr. Asmhan.
Thank you.
Yeah.